Hey, are you turning 65 soon and gonna be eligible for Medicare, but you want to keep working? You don't plan on retiring and not sure what to do? You are in the company of many other people who are confused and unsure what to do. So let's get into what to do with Medicare and retiring. Should you stay on your employer plan? And what are your best options? Hi, I'm Cullen Tesco with Strive Medicare, making Medicare simple. So you may be turning 65 and wondering, should you retire? You want to keep working? Should you go on Medicare? And so let's get into some of the nuances of this not so unique situation of wanting to work past 65 and being Medicare eligible. So first of all, if you are turning 65 and not going on Medicare, you need to have typically employer-provided health insurance if you're not going to Medicare, or you'll be penalized by Medicare. Medicare says that you have to have Medicare Part B active, or else you're going to be penalized, or you have credible coverage through an employer plan. So things like marketplace coverage, COBRA, Medishare plans, those things do not count as credible coverage, and you will be penalized by Medicare. So if you're turning 65, make sure that your employer-provided benefits count or go on Medicare Part B. You can learn all about Medicare, Medicare A and B, and the optional plans that go along with them, and some of our other videos that we'll have linked. But you need to have either employer-provided benefits or Medicare Part B once you become eligible. So let's talk about Medicare's requirements for the health benefits, the employer-provided plan, your health insurance through your place of work. So there are some stipulations Medicare has. Generally, if your employer has less than 20 people, Medicare is going to pay first for your health insurance. If you're in this scenario, it doesn't make sense to keep your employer-provided plan because you're going to have to pay for that, even though Medicare is going to be providing you the coverage first, and you have to have Medicare Part B, and so you're paying for both. That just doesn't make sense. And so if you're not sure if there's 20 or less employees in your at your place of work, just contact your HR department and see how they file the Medicare. They'll be able to help answer that question for you. If you have more than 20 employers, now it becomes a matter of math, frankly, and budgeting that works out for you. So some things that you want to think about is how much is your employer-provided healthcare costing you per month? What are your co-pays, deductibles, max out-of-pockets? Because you're going to want to compare that to what you could get on a Medicare plan, and then just go whichever way provides you the best coverage at the best price. If your employer plan is costing you a ton of money a month and it's high out of pocket, maybe Medicare is the right choice for you. Or maybe you've got a great package and your health insurance is basically free. I don't know, maybe that doesn't exist. But if that's what you have, then maybe go ahead and stick with that. A helpful thing that I like to look at here, I call it the 275-2000 rule. And what I'm talking about is if your employer-provided benefits costs you more than $275 a month, or has a max out of pocket of more than $2,000 a year, it's definitely worth your time to check into Medicare. Go ahead and check if you're turning 65 no matter what, but if you're paying more than $275 a month, or if your max out of pocket is more than $2,000, you can probably find a better deal on Medicare. A few other things to think about: if you're staying on your employer group plan, just make sure that you have creditable drug coverage. This is drug coverage that is as good as Medicare. Again, your HR department should know about this, or reach out to us and we can help with that, because in this time of transition, in this season of change that you're coming to, turning 65, being eligible for Medicare, maybe wanting to work more or less, maybe wanting to retire altogether, we want to make sure of two things. Number one, that you have the best coverage for your specific healthcare and lifestyle needs. And so we can do that with you one-on-one. Number two, you got to make sure that you are not penalized or that you have any gaps in coverage. That's really important. So you may think that your employer group plan, okay, maybe this is the plan for me. Turns out it doesn't have credible drug coverage. Down the road, you go on Medicare, and now you're paying a monthly penalty because of that mistake. And so we want to make Medicare simple, and we want to help you avoid those mistakes. So if you're at a larger employer and you want to stay on the employer benefits and not go fully on the Medicare, that's fine. Just make sure you work with your HR to do that, or work with us here. And then make sure you're not paying for Medicare Part B. That can be another mistake, because then you'd be paying for your employer-provided group benefits and Medicare Part B. That's excess. You don't need to be paying both. And so if you need any help with Medicare or retirement or transitioning health cares, some people with the 275-2000 rule, they continue to work after 65, but they take the Medicare benefits because it's better coverage. And they're able to make more money, save money, and get better coverage. Kind of a win-win there. So if you need help with any of those things, go ahead and give us a call with the number that's on the screen here. You can also book to schedule a free consultation. The phone call, the consultation, everything we do with you is for free. And most people, we can do it in less than an hour. So if you want to go on Medicare, book a time with us. We'll get you the plan you need that fits your budget, your lifestyle, the coverage you want for free in less than an hour. So I look forward to talking to you. Check out our other videos, and we'll see you.